Hello, my name is Julie Hebert, and I'm here to go over the City of Liberty employee benefits for the 22-23 year. These benefits all start October 1st. This handout is available to you through Jody. The meetings that we're having are also, this document will be online. This is my contact information, my number, my email address. Please feel free to contact me anytime. We are the Hebert Group, along with my husband, Stephen Hebert, and my dad, Jim Hall, who's mostly retired at this point, but if you need something, he's certainly available to you. So the City of Liberty is pleased to continue to offer excellent employee benefits. They pay 100% of the employee coverage for life, medical, dental, and vision coverage, and 55% of those coverages for your dependents. The cost per pay period, of course, is nothing for the employee only. Employee and spouse is $196.50. Employee and child is $112.27, and employee and family is $269 per pay period. You guys are on a biweekly pay schedule, so that means every other week you get paid. So this is open enrollment. This is the time of year that if you want to make changes because you want to, this is your opportunity. You can add, drop, delete, add dependents, whatever you want to do. This is the time where you don't have to have a specific reason to make those changes. You have from now until the end of September to make those changes. We like to have the majority of the changes done by the 20th of September, just so that we have enough time to get everything over to the carriers and get everything in place for you for October 1st. You're eligible to include any dependent children up to age 26, regardless of their marital status, and regardless of whether they have access to coverage through another employer or another source. All open enrollment and changes are effective October 1st, 2022. If after that point you need to make changes, it would have to be because a special event occurred, like the birth of a child, the loss of coverage from your spouse's employer, adoption, marriage, things like that. If one of those life events happens, you need to be sure and let us know within 30 days so that we can make that change and get your coverage in place. All employees are eligible on the first day of the month following 60 days of employment. Jody and I work together on that real closely to make sure you guys get covered in a timely manner. So we're going to continue this year with Cigna Health. When we first got our renewal from Cigna this year, it was a 24% rate increase, which is very significant for the city. We worked with Cigna and some other, our Cigna representative to work on getting that lowered to where it was a tolerable amount that the city's budget could afford to continue to maintain your employee-only coverage at zero cost. It did require us to make some changes in your coverage. This year, you're going to have a calendar year deductible of $3,000 per person, $6,000 per family. Once you've met that deductible, expenses are paid at 80% and you pay 20% until you reach a maximum out of pocket of $7,150 and $14,300 for the family. Now, this amount changed. That deductible did change. It was $1,500 and $3,000, but those changes allowed us to keep the coverage at an affordable level for you guys for the city's budget. Also changing is the urgent care copay is $75. You'll notice the emergency room copay is now $500. It was previously $250. But we had to raise that to $500 because we are having a lot of people use the emergency room, and that's causes quite an expense in the plan. Once you pay that copay, you're also subject to your deductible and 20%. And the urgent care visit is a $75 flat copay. So even if you go to the urgent care and they run an x-ray on you or run some lab work, you just have the flat $75 cost. Or if you go to the emergency room and they do that same x-ray, you have the $500 copay, then you also could be subject to your deductible and 20% co-insurance. So it'll be a lot more expensive visit for you. So we'll talk a little bit more about that, but that's something to keep in mind. Your primary care copay is now $30 and a specialist care so to go to a specialist doctor is now $60. That was $20 and $35. You do not need a referral to see a specialist, and preventative care is covered at 100%. If you need to go into the hospital or have outpatient procedures done, you will have to meet that deductible of $3,000 and then be subject to your 20% co-insurance. We do continue to use Cigna Pharmacy as our pharmacy provider, and we continue the same copays on the prescription drugs. Also included some information on how to get logged into your MyCigna account. You can do this on a computer or via the app. There you'll be able to find in-network doctors and hospitals, which significantly helps your cost of coverage. You can manage and track your claims. You can see cost estimates for things like MRIs and things like that. You can look for quality of care information for doctors and hospitals. And you can also access a variety of health and wellness tools that are available to you. So here's how to register for that. And here's some information on the steps they take to make sure your information is secure. And then here's information on how to do it on your app if you're more comfortable accessing this information in your handheld phone then rather than going online to a computer. This is a way to be able to do that. It talks about what all is available to you. This talks about being able to use MD Live. This is a service where you basically call and request a doctor to call you, and a board certified doctor in Texas will call you back. And they can help you with things like allergies, cold and flu, stomach aches, headaches. I think I've probably told this story before, but one time our daughter Emily was hurt on 4th of July weekend. I hurt her foot and I did not want to take her to the emergency room on a busy weekend like that. It didn't seem that urgent, but I took a picture of it, sent it into MD Live, talked to the doctor, and they were able to call in an antibiotic for me without me having to go and fight the crowds at an urgent care and emergency room on a holiday weekend. So it's very helpful. We've also used it when we've been out of town, things like that, where you can't easily get to your doctor. Or sometimes you just kind of know what's wrong with you and you just need someone to call in a prescription. Something like Pink Eye would be a great example of that. You could take a picture, upload it to their website. They would be able to look at that and write you a prescription without having to go see a doctor in person. Also, there's some great behavioral and mental health options available to you. You can talk to them about concerns with addiction, eating disorders, grief. These are all things that you can do now through virtual visits with a counselor. And here's some information on how to get signed up for that. That's a great way to do that in a very discreet manner and on your own timetable, and deal with things that are bothering you. And that's available to you at a very low cost. All the MD Live visits are available to you for $30 a visit. This is talking about what I was just mentioning and using the urgent care versus the emergency room. From left to right, the cost and time involved on your time of being treated is lower at a virtual care. If it's something kind of a minor cold or flu type symptom, maybe like I said, a cut or a rash, something like that, might be a good opportunity for you to try the virtual care. This gives you instructions on how to get signed up for that. Again, that's a $30 visit, or you can go to your primary care doctor, and that's also a $30 visit. Again, the benefit to the virtual care is you can do it on your own convenience and from the comfort of your home. Then you also have the option to go to an urgent care center, and there they can deal with fevers and flus, minor cuts and sprains, headaches, lower back pain, joint pain, respiratory issues, urinary tract infections, things like that. The emergency room should really be reserved for life-threatening situations or where you have real concern about your critical injury. It should be things like uncontrolled bleeding, unconsciousness, shortness of breath, chest pain, severe cuts or burns. These things can be handled in an emergency room, but try to keep that only for an emergency type situation. Please be aware that if you are admitted to the hospital for the reason for your emergency room visit, those large copays are waived. But if they just treat you and send you home, you will be subject to that $500 copay. And that's something just to think about when you're picking your care. Be careful of those standalone emergency rooms, like Patients ER. They are considered emergency rooms and will be billed that way. And this information will be readily available to them whenever they treat you. And so I'm worried about that $500 copay, where previously it had been $250. Finding a doctor in the network is easy. These are steps on how to find a doctor in the Cigna network. If you can stay in network, you're definitely going to get a much better benefit. This talks about your retail pharmacy options and how to get a 90-day prescription. You can do that through the mail or actually through any of these pharmacy providers here. You can get a 90-day prescription in person rather than dealing with all the mail and all that work. You can actually go to CVS or Walmart and get a 90-day prescription just as you would a 30-day supply. So those are nice things for routine medicines like blood pressure, cholesterol, diabetes medicines, things like that. This talks about how to fill through Express Scripts Pharmacy. And again, this is mail order. This is something where you kind of set it up at the beginning of the year and it's kind of on autopilot. You don't have to worry about that. It's going to be mailed to you as you need it. So that's a great option. This year, we're switching back to Cigna Dental. Last year, we had MetLife Dental, and we were able to save a little money by switching back, and they offered us a discount by combining the dental, vision, and health insurance back with Cigna. I know you guys were fairly happy with their dental and vision previously, so this was kind of a win-win for everyone, going back to something we know and are comfortable with and saving some money for the city. So with your dental plan, you're able to get your teeth cleaned twice a year and get diagnostic x-rays done at no cost to you. There's no waiting period and no cost to you. Then if you go and they say, oh no, Julie, looks like you're going to have a filling done, you're going to pay a 80% and they're going to pay at 20%. If you have to have like a bridge or a crown, then they're going to pay 50%. You're going to pay 50%. And then you do have orthodontia coverage for children up to a $3,000 maximum lifetime limit. So as I said, we're going to go back to Cigna Vision. And so that's something we had year before last. And for several years we had them. So same benefits, just different provider. So your eye exam is going to be a $10 copay to get your eyes examined. And then to get new lenses is going to be a $10 copay for single, bifocal, or trifocal. You can get new frames up to $150 frame allowance. So in theory, you should be able to go to the eye doctor, get your eyes checked, and get a new pair of glasses for $20. Pay particular attention to the network and out of network. Again, it's important that you stay in network and that you choose an eye care provider and an eye care fulfillment center that are both in the network. If you choose to get contacts instead of glasses, you can have $150 contact lens allowance, and you can get new lenses in your glasses every year and new frames every other year. And on the dental and the vision, there's some information on the bottom of that tell you how to find a provider. The city does provide life insurance for you up to 2 times your annual salary. And that's a great benefit. We need to make sure we keep your beneficiaries up to date. And that's one of the reasons we have you do EASE every year, is to review that information and make sure the person you're leaving that benefit to is still the person that you want. If you retire with the city, you receive a $5,000 life insurance benefit. So that's a nice thing if you stay long enough and retire with the city. You also have the ability to cover your spouse. That's another benefit to you that's free. You have $5,000 of life insurance for your spouse and $2,000 for each child through age 26. This talks about that because it's such a nice benefit of life insurance, anything over $50,000 of coverage, you do have to pay income tax on. That's included in your W-2. You don't have to worry about that too much. But this tells you if you were to become unemployed by the city or leave and you wanted to continue your benefits, this would be the cost of coverage. And this talks about your Medicare coverage. So that's really the bulk of your benefits. Again, my name's Julie Hebert. We're here to help you. If we can ever be of assistance, please feel free to give me a call or an email. Appreciate your time and all you do for the city. Thank you.